Hi, everyone. This is Doug, and I have with me today Tom O'Brien. Now, Tom and I worked together at Johnson & Johnson a number of years ago. And actually, I'm going to let Tom tell you about his background and the role he's in now. And then, Tom, I'm going to ask you, the reason I have you speaking today is because of your depth of experience in developing and applying insights into the marketing challenges. And those insights can be applied across all 4 Ps. So I'm going to ask you to introduce yourself and then tell us a little bit about what you think about insight development and how you put it to work.
Okay, thank you, Doug. So I'm Tom O'Brien. I'm currently the president of our endomechanical business as part of Ethicon. But my career has touched many aspects of marketing, where I originally started out in Procter & Gamble and got some experience with beauty care and actually marketing and developing beauty care brands such as Pantene, brands such as Head & Shoulders. And then from there, moved and made a little switch and got into software and actually was doing more business to business applications in a small startup environment, and then joined Ethicon and have worked in various areas in Ethicon, everything from the GI business that Doug and I worked on to our bariatric business, our energy business, and now our endomechanical business. And all along the way, insights have been a central part of really the biggest successes we've had in the marketplace. And if there's one common theme, whether regardless of what industry you're in, whether you're selling products to consumers or whether you're selling products to doctors or institutional customers, is getting the insights right goes a long way to getting the value proposition correct. And what I tell the teams that I work with are that insights aren't just facts. It's not, I've got an insight, I've found a fact from the marketplace. It is really getting to a piece of information that gives you a unique perspective on how the user of your product, the user of your service, ultimately gains value from it. And when I can start with, I'll start with an example that I'll share with you. But before I do, I want to kind of show you and talk a little bit about where insights belong in the marketing mix. Insights are usually the starting point. We gather information, we try to understand how our customers are what needs they have today, how they're using products that exist in the marketplace today, what compensating behaviors that exist. And those are some of the more difficult things. Compensating behaviors, more often than not, a customer can't tell you whether they're making a compensating behavior, but you have to watch and look for it. Those are the most valuable types of insights, because those insights lead directly to needs that they may not, your customer may not be able to tell you directly, but when you latch onto them, when you figure out what they are, they can lend themselves to a perfect value proposition. And that's really where our insights lead, is insights tell us what the needs are, and they ultimately tell us what the value proposition looks like. And for most of us in marketing, the way we look at insights are they're the first step in developing a concept. And a concept usually has a couple parts. The first part is the insight that kind of sets the stage for our customers. The next stage of it tells them what the benefit is. What are we actually providing to you? Why is it a value to you? And then the last part of it is, why should you believe that we can actually deliver that benefit? So a good example of how an insight comes into formation and how it changes the value proposition is some work we did a number of years ago with a endocutter product. And I'll explain what an endocutter is first, so that'll help everybody. But an endocutter is used for transecting tissue. So it's used for separating, if you're doing surgery, where you have to go in and you have to separate two pieces of tissue. When you cut it, if you cut it without doing anything, it'll just bleed. But if you cut it and you lay down a row of staples on either side, you'll be able to separate the tissue and you won't have any bleeding occurring. And it's very often used in major procedures, typically used in cancer cases. Bariatric surgery uses these devices. So think of them like big staplers. They'll lay down on average about 80 staples or more on either side of the cut line. as you can imagine, if you're used to firing a device or using a device that lays down 80 staples at one time, that's going to be hard to fire. It's going to take some effort. And the way we've overcome that is we developed devices that required you squeeze them multiple times. So think of it typically as if instead of a device where I just squeeze it once, it closes, lays down staples. Here I may have to squeeze it 3 or 4 times to actuate the device and get all those staples to come down. Well, you can imagine that if you're firing something and you're squeezing multiple times, that's hard to do. And so the innovation was developed within our R&D labs of what if we put a motor behind that? Well, if we put a motor behind it, that ought to make things easier. And so the original concepts that came out from the teams were, hey, we can make the stapling much, much easier. You'll be able to fire the device, the motor will take it, it'll drive it. It'll be easier. People who have smaller hands might be able to more easily fire the device. The problem with that is, yeah, it's all true, but it's not a really strong insight or benefit that, my device is just easier to use. So we asked the team, go back and take a closer look. Really understand what value, or think about what is the value you're creating when you actually fire an endocutter device. And the value is really around being able to deliver a transection of tissue with few or no complications. So how would putting a motor on the end of the device actually help us there? Well, it turned out when we started looking at it from the standpoint of how would I minimize complications, all of a sudden this question came up, or this discussion the surgeons raise is they talk about, well, when I'm firing the device and I'm having to fire that multiple stroke, that the tip of the device is moving all over the place. I mean, you can imagine in surgery, if the tip of the device is moving all over the place, that's not good. That can interfere with other tissue. With a device that you fire with a motor, you could hold that tip within the same space, maybe might move a millimeter or two, but it's not going to move much. And so having the insight that tip stability, which is essentially what they were telling us, is really important for minimizing complications, built the proposition. And so once we were able to talk about it, I could show that same device and hand it to one person and say, tell me, isn't this much, much easier to fire? And I could give it to this other surgeon and I could say, here, this device is going to be far more stable when you're doing a firing across the stomach, let's say, or across a major organ. With those two different insights and unmet needs, one is an average proposition. The other is a category changer, one that changes the standard of care. And it's just a simple framing of getting the insight right, understanding essentially what's driving the use and the need for the device in the first place, and asking a few questions about why to really understand, what are you trying to accomplish? Why are you trying to accomplish it? Those are the secrets to getting to an insight. So Doug, I hope that helps provide an example of the value of insights.
It does. And you hit upon the real key at the tail end there too, about how do you get to these insights? What are some of the questions you ask? Let's take a little bit of a short break here and come back and dive deeper on that topic.
Sure.
Great.